Could we ask you to take your seats, please? Isn't it a gorgeous evening? Just wait for final members to sit down. So good afternoon and a very warm welcome. It's lovely to see so many people in real life. So thank you very much indeed for coming. My name is Angela Schofield and it is my great privilege to be the chairman of Harrogate and District NHS Foundation Trust. And we're very, very pleased to be able to welcome you to our annual members meeting and in person this year, which makes an enormous difference. So thank you very much for coming. As you know, we had to hold our meeting last year by video conference, not quite the same thing, but it's important that we account to you for what we're doing. But it was we did really miss this opportunity to have a cup of tea and a biscuit and a bit of a natter. So we're glad that we've been able to restore it this year. We have had to restrict numbers because we've got to maintain social distancing. So we're actually filming the annual members meeting live on YouTube, and you will also be able to access a recording. So for members who are still at home, if they wish to do so, they can watch us live on YouTube. They can't participate. It's important that you know that it's only the presenters who will be seen. So there will be no members of the audience will be filmed. So please don't worry about that. Just a bit of governance formality that we have to do every year. The minutes of last year's meeting have been approved by the Council of Governors and they're available on the Trust's website. As I said earlier, we're still having to maintain infection control and prevention guidelines. COVID-19, as you know, is still active within our communities. So please maintain social distancing, wear a mask if you're circulating, and sanitize your hands as often as you can. The annual members meeting is a really important occasion for us. It's when we formally report to you, our members, for the Trust's performance in the previous financial year. So that's the year 2020-2021. We've asked some of our colleagues to present to you in a little while, just after I've spoken, about about 3 elements of the Trust's services, which we hope that you will find interesting. And then after they've done that, then we'll have the more formal bit of the meeting where the Chief Executive and the Deputy Director of Finance present the annual report and accounts. And then our lead governor will present on the work of the Council of Governors. We've provided you with a summary of the annual report. You probably don't want the full report because it's very, very long and quite a lot of words. But we've provided you with a summary, which you can see. It's got the rainbow on the front. And that gives you some key statistics about the work of the Trust and just a bit of background about the previous year. When we had our annual members meeting on the 29th of September 2020, I don't think that any of us thought that the virus would still be as active as it is and that our communities and our lives would still be affected in the way that they are. At that time, our focus was on restoring services, never imagining, I don't think, that there'd be another very long period of lockdown after Christmas. And the implications for the Trust services were considerable, especially the anxiety for colleagues, the complications of caring for children. Are they in school? Are they not in school? Being sent home, self-isolating and all of that. Also caring for older relatives and the real worries about not being able to visit relatives. And also for many of our colleagues, the anxiety of caring for patients whose relatives weren't able to visit them. So there were enormous pressures and many colleagues had to take time off work because they were self-isolating or they'd actually contracted the virus. However, there was a glimmer of hope and the hope came in the form of vaccination. And I think the NHS as a whole rose to the occasion. And here at Team HDFT, the colleagues were absolutely magnificent in getting the arrangements put in place and providing a really good, friendly, caring and professional service. And I think there was a great wave of relief amongst probably most of the people in the room when we'd all had our two jabs. And the well-being of our colleagues is the biggest priority for us. We know that so many people are still very tired. We're encouraging people to take holidays, but it is still a very, very big issue for the NHS as a whole and for our teams in particular. And we care greatly to try and ensure that we are listening to them to find out what we can do, to learn from them about what we can do to support them. So, as you can imagine, it's been an unusual year and in many ways difficult to carry on with business as usual. However, the Trust's executive team have continued to lead a major piece of work, which has involved everybody in the Trust, or everybody who wished to be involved, in redefining our values and committing to behaviours which uphold the Trust culture. We call it At Our Best, and you will see the kite. You can see it just about everywhere you go, which encapsulates our values: kite, kindness, integrity, teamwork, and equality. So this is what we've all committed to. This is what our colleagues have identified as being the most important. So just before handing over to Suzanne, I would just like to end my welcome with some thanks. Thank you to the team who's organised today's annual members meeting. As you can see, it's not quite the same as it usually is with being so spread out, but I think they've done a great job, and it would be interesting to see if you feel that it's been worth it to come and actually meet face to face. A very, very big thank you to our volunteers. We've got so many volunteers and they've been so steadfast through the period of the virus. Some of them have had to do different things because we've not been able to support them to do their normal volunteering. But a very, very big thank you to them. Their desire to be part of HDFT team is very much appreciated by all of us. They make such a difference with their ideas, their friendship and their time. Many people and organisations raise funds for us and they allow us to do so much more than we would. So a big thank you to them. Thank you to our governors, who majority of them are here this evening hosting this event. They give their time freely and provide so much support and oversight to the board. And I'd particularly like to pay tribute to Claire Ellingworth, our lead governor, who you'll be hearing from a little bit later. Thank you to the board of directors. In the last year, Jill Foster, our chief nurse, left the board, and I would like to thank her for all she achieved. We've been joined recently by Emma Nunes, our new Director of Nursing, Midwifery and Allied Health Professionals, and also recently by Russell Nightingale as Chief Operating Officer. I believe, and I would say this, but I do believe that the board has provided strong and effective leadership for the Trust. Thank you to you, our members, for your extra encouragement and support over the last 18 months. It's been so glad to know that you were out there clapping for carers, putting rainbows in your windows and providing gifts that just kept arriving at the hospital through the charity. So thank you very, very much indeed. We really, really do appreciate it. And my final thanks go to all of the 4,800 wonderful colleagues who make up HDFT. They are absolutely magnificent. I should say, we'll be hearing from them later, HDFT and Harrogate Integrated Facilities. Thank you to all of them. They are absolutely, truly outstanding. So I'm now going to hand over to Suzanne Lamb. She is going to talk to us about our 0 to 19 services, which may be new for some members, but it's a very, very, I think almost 50% of the services we provide and almost 50% of our colleagues work in the 0 to 19 services. And we go right up to Sunderland, Gateshead, Darlington, Stockton, Durham, where have I missed? Middlesbrough and North Yorkshire. Suzanne, you might just want to hold on to the wall.
Hello everyone. My name is Suzanne. I'm Head of Safeguarding and Head of Nursing with the Children's and Community Directorate. So I've been asked to talk to you about what happened to us during the COVID pandemic. And I've really split this up into three sections, which was how we prepared within 0 to 19 services, what our response was, and then what recovery has been like. So in terms of preparation, if you take your minds back to what it was like in those early days of the pandemic, it was very much for our staff, just like it was for the communities that we serve, really. A lot of panic, a lot of concern, and it really became obvious quite quickly that what we had to do was focus on our staff and really make sure that they were fine. They were very worried. If you saw at the same time, a lot of our staff they don't work in the hospital, they work in the community. It's a home visiting service. They're going out to people's houses every day. People were nervous about having anyone going into their homes, but importantly as well, they work really closely with other partners such as social care. And many of our partners were no longer visiting. It became really apparent that it was important for the 0 to 19 service to really maintain that contact with children and families at a time when they really felt vulnerable. It was a lot about rumour control at first. There was a real lack of facts, if you remember, at the start. And we really had to very quickly look at our governance structures to make sure that we could provide information to our teams quickly. That really meant that we were reliant on increasing our IT capacity and making sure that everyone had the equipment that they needed in order for us to keep in touch. Prior to that, everybody had worked in bases. They all worked together in teams. Suddenly, all those bases were closed and people were working from home. This was a time when the Team HDFT really came together, and the way that our IT colleagues rolled out the changes to the IT infrastructure was absolutely amazing. And it was so important because that was what maintained the service and meant we could keep visiting people and, importantly, recording those visits. So we got people onto the VPNs, we put WhatsApp on people's phones so they could do virtual contacts. We had people at the time, this is way before we'd even got into a lockdown, we had people who were out on secondment. I remember one morning phoning some colleagues in a local authority and asking if we could have a member of staff back. And that was at 8:30, and that person was back with us at 9 o'clock. So it was really a testimony at that time to how quickly you could make things work, but also how well people work together. We looked at the time at developing a business continuity plan. We didn't know at that point when we were going to lock down, what was going to happen, but we quickly pulled together a business continuity plan. And through our governance structure, we made sure that that was communicated to all our teams really quickly so that they knew what was happening. As you know, we quickly moved into the lockdown situation, and that business continuity plan was really, really important at that stage. We knew we had to still maintain face-to-face contact. Many of our families are mothers with new babies. Many of those families are very vulnerable. But even mothers who don't have those established vulnerabilities need someone at that time. We knew we had to make sure that when we went to do a contact, we could do everything within that contact. And at that time in the first lockdown, we really prioritised so that even if someone was COVID positive, we could go out and see them at the time when a new baby was born, because that is the time when they need our staff to go and visit them. At that stage, many of our midwifery colleagues in other areas weren't even visiting, but they would still count on getting a visit from a health visitor. It was about managing risk at that stage. In the very early stages, we hadn't even worked out how we were going to get PPE out to Sunderland and Gateshead. That was quickly sorted out, and we had volunteers who literally put PPE in their cars and drove it up to the northeast. So we quickly, and I have to say we had other trusts who gave us PPE to make sure that we could carry on working very quickly. We had to look at setting up clinical advisory groups because there was clinical decisions that needed to be made very quickly. And the one thing that I noticed that changed dramatically was how quickly we made decisions. So things that had to jump through bureaucratic hoops in the past that would take quite a long time to go through. Suddenly we would make a decision on a morning and that would be passed and agreed by the afternoon. It would happen that quickly. But that requires really efficient IT, because we were all now meeting virtually. You may remember when we first started using Teams, I was really nervous. I didn't even know if it would work. And now it's just something that we do all the time. But that was how we started, really. I remember having our first board meeting, our children's board meeting, by phone. And by the next meeting, we had an efficient Teams service. It was at this time that we were called for redeployment. So many of the other trusts that we work in the areas with, so County Durham and Darlington Foundation Trust, for example, Sunderland City Hospitals, they contacted us and asked us if we would support them with the COVID response. So some of our staff were redeployed quite quickly, and we've had some amazing experiences of, for example, some of our school screeners. These are the Band 3 staff who go in and they roll out screening programs in schools. Obviously, all the schools were closed. So those screeners started working in public health and providing support for swabbing services. We had nurses who were working in swabbing centres. But we really retained the focus on our staff delivering on the front line, carrying out virtual visits and wherever possible, carrying out face-to-face visits with a risk assessment. All the time we had to maintain a really high priority of making sure we had really excellent communication. So we put in a situation where every day staff would be briefed and they would get newsletters. They would get decisions out of clinical advisory groups within hours of those clinical advisory groups meeting. So things happened extremely quickly. At this time as well, some of the money started coming through just in the early days that you may remember. There was a lot of money came into local authorities, and suddenly we found ourselves having to create new teams. So, for example, in Middlesbrough, we got some extra funding there. There was a focus on children and young people's mental health, and we quickly drew together a plan to provide an emotional health and resilience team for the children and young people in Middlesbrough. And all of that happened really, really quickly. So during COVID response, we really focused on safeguarding visits, visiting those families who were most vulnerable, and always visiting those families who'd had a new baby. As we moved into COVID recovery, we would be looking at our recovery plans and a business continuity plan. But what we saw was the unfortunate after effects of the lockdown was that we saw some quite unexpected outcomes with children, young people and families. I think one of the ones that we didn't see coming, but that did happen, was quite a big increase in the injuries to babies under 12 months. That was quite a significant and alarming outcome that nobody had really seen coming. And that was a national outcome, but it also translated locally. So we started to see very complex and quite significant injuries to very young babies. We also saw a dramatic increase in domestic abuse. And the effects of domestic abuse on the family is that results in emotional neglect on children. So obviously that was something we had to really focus on. And we saw an increase in child sexual exploitation. A lot of that happening over social media, and we did see a big increase in that as well. This meant that the work that our 0 to 19 teams had to do changed significantly. We always focus on safeguarding families, and that remains a priority throughout everything. And what that meant was the result of that is you have increased strategy meetings that we have to go to. We have increased child protection conferences. There's many more reports have to be written about children. That includes the assessment of risk. children being removed and all the processes that go along with that. That meant that our 0 to 19 staff were now delivering on a safeguarding agenda, and they were moving away. They had to move away from the early intervention and prevention, which 0 to 19 teams do. That inevitably leads to a circle. If you're not doing the early intervention and prevention, then you're not preventing these things from happening. So we've rapidly reviewed the roles within our service. This, at the same time, we realised that we had a real recruitment problem. And so what we've started to do is we've been really reacted quickly to that. And we've started employing staff who are not necessarily health visitors and school nurses to work in safeguarding. We also pulled together a business plan really quickly, and we've got more staff now working in safeguarding to really tackle the problems that we've had and we've noticed, and I'm afraid that are still happening. We had great support from the Trust with that in terms of not only the business plan, but also after our staff had been redeployed into the hospitals, we actually now are in a situation where some staff from the hospital have moved out to support us with safeguarding, and because that issue is still going on. So that reciprocal arrangement was really appreciated. So now, where are we now? We're in a service that a year on from the pandemic looks entirely different to the one that we had a year ago. We've got different roles within that service. We've got people working very differently, and we've got people who are working much more at the high end of safeguarding than they were a year ago. We're really concerned about that, because what we'd like to get back to is being able to focus on the early intervention and prevention that supports families from becoming vulnerable and supports families from going into the child protection processes. And that's what we're trying to do. We're trying to really focus on getting our staff back into working in early intervention and prevention. We've now got all our staff back in service. That's where we're really focusing on. And it's been, I would say that if you met any health visitors and school nurses now, they would say to you that they're working in a very different service this year than they were in February last year. I hope that's been helpful and something about how we've experienced it within 0 to 19 service. Looking forward, we're growing, and as I'm sure you're all aware, we're about to mobilise a contract in Northumberland now. So our contract areas are getting a lot bigger, and I hope that's down to the success of a really positive and forward-looking 0 to 19 team. Thank you.
Thanks very much, Suzanne. Is the microphone on? Yes? Yeah. Can you hear me now? Yep, Mike got the thumbs up. We'd like to welcome and introduce Beth Barron and Claire Ardito. They're from our, they're going to talk to us about outpatient services and how they are being transformed in the light of our recent experiences. So Claire, you're starting.
I'm starting. Yes, thank you. Good evening, everybody. Thank you very much for having me. My name's Claire Ardito. I'm a General Manager and Trust Allied Health Professional Lead within the organisation. I'm very pleased to talk to you tonight a little bit around our outpatient transformational work as a result of not just the COVID pandemic, but initiatives that the NHS is really encouraging us to take forward over the last year, but also moving forwards. I'm also the Outpatient Transformation Lead, which is really why I'm here today. Oh, wrong way, that would help. So most of you will be very familiar with the fact that hospital services had to change dramatically very quickly at the beginning of the pandemic last year, and in particular our outpatient services, which, because of a number of factors, social distancing, patients who are clinically extremely vulnerable or needing to shield weren't able to attend hospital appointments, And also we had cancellation of our non-urgent elective surgery. So this affected our ability to provide what we would normally do for patients from an outpatient perspective, but not just only that, some of our diagnostics and our endoscopy and elective surgery. So Beth's going to just talk to you a little bit as I've finished my section around our elective surgery recovery as well. So in terms of outpatients, we had many opportunities quite quickly to consider a number of elements. And I think from my perspective, we had to work at pace and utilise innovation and digital technology very quickly, a little bit like Suzanne mentioned, to enable us to deliver our services effectively to patients. There were some national drivers as well as COVID, and although it might feel like COVID absolutely consumed everything, actually there were a number of national drivers that were really important as well for us to consider. The NHS long-term plan and also some money that sat behind our operational planning guidance called the Elective Recovery Fund, which as part of our ability to recover our services, we were set targets by the NHS to actually encourage us to respond quickly to deliver our level of activity that we were previously delivering in 2019-20. So we were trying very quickly to turn ourselves around to our previous levels of activity. And as part of that, that included some specific gateways for us to consider, and outpatient transformation sat within that, and also other really important elements such as identifying and addressing any health inequalities. And you can imagine with some of the technology that we were asking patients to utilise this year, we needed to really think about digital inclusion and how we would be able to encourage our patients to use some of this new technology. So our outpatient transformation aligned really well with some sort of other elements that we were focusing on in the organisation, our digital transformation strategy, but also wider across the system. And we sit within the Humber Coast and Vale integrated care system, and we were being able to work really effectively with our colleagues across the system to be able to learn from each other and to support each other to develop our outpatient transformation strategy. So there were a number of things that we really wanted to focus on. And I know there's a lot of detail on here, but I'm hoping that you might be able to have access to these slides later, because there is a lot of really important detail that I think is helpful for you to understand. And firstly, our hospital access for patients was really important to us, and that patients would only attend hospital when absolutely necessary. And we felt that, and we know that there were a number of reasons why patients might not need to come in, you know, for simple reviews, for conversations with clinicians that could very, very easily be done in a different way. And to do that, we needed to ensure our patients were digitally enabled. We're not there fully yet, it's part of our vision, but we've been doing a whole range of work around patients accessing information around their own condition, and I'm going to go into a little bit of detail around that, but also accessing information about their appointments, etc., receiving text messages to enable them to access our services in a different way. And we are currently piloting a patient portal, which is a means by which patients can communicate directly through an app. And then also thinking about how patients, when they're at home, can also access their services, their information through contact with us via different routes. So that was the main area of our focus. So very quickly, we were able to set up virtual appointments for patients through a system called Attend Anywhere. And this required very quickly, rapidly, our clinicians getting trained up for us to develop protocols to do this safely in line with information governance, and also to make it, where possible, accessible to patients who wanted to use this means of communicating with us. And this was by no means enforced upon patients, but it was a means by which, if they felt able to, we would provide them with support to do that. And we continue to do that, and our aim is to continue to expand that out. Moving forward, this is a new way of working that we did quickly, but actually it's here to stay for patients who would like to use it. So Attend Anywhere is one means of contacting us and doing our appointments, but the other way is obviously by telephone, which we've done before. So some patients, that was their preference, and that was absolutely fine. And then the second element that we're really focusing on now is something called patient-initiated follow-up. Some of you may already have had contact with us through what we call open access, where you have a long-term condition perhaps, and you can contact a telephone number or a clinician, a specialist nurse directly without needing a follow-up appointment. Well, the NHS is rolling this out much wider than that, and this is really about empowering you all to make some decisions about your own care and to contact us in a different way. So we're working on that at the moment, and we're working with a number of our specialities to deliver that. And this actually, I've just got here on the right hand side a picture of something called the Harrogate Health Hub, which is I'd encourage you all to Google Harrogate Health Hub, and this is a means by which you can see the way in which we're trying to deliver education and information for patients about managing their own conditions. And so really please do look at that, because there's a wealth of information on there. And then the third element is something called advice and guidance, and this is a means by which our GPs are able to contact our clinicians to get specific information regarding an individual's health and care without the patient having to actually come in for an appointment. And we always provided this before, but this has really been ramped up now, and we're aiming for all of our specialties to respond within 14 hours to requests from our GPs regarding specific clinical care.
So by doing this, as I say, we were able to sustain some of our work and treat some of our patients. We continued to review our clinical priorities. We continued to review our clinical pathways to ensure that we were adapting and making sure that enough available capacity was being provided for increasing the number of patients we could put through our services. So where are we now? Throughout that process, we have undertaken a huge piece of work with our clinicians. We have assessed every patient on our elective waiting list and prioritised them. That has not been a singular piece of work. That has had to be a multidisciplinary approach with our clinicians. And that work, it continues to be undertaken, because we want to make sure that those patients that are waiting the longest are still being reviewed, and we are fully aware of any changes in their care and reprioritising where they need to be as far as treatment is concerned. We're continuing to review our green pathways, understanding how we can adapt them safely. As has been mentioned before, we still need to maintain social distancing, and we still need to maintain that safe environment. But we also have to understand that we need to increase our capacity in order to make sure that we are managing our waiting lists successfully and treating our patients that are waiting. We have continued to work with our local independent providers. We have agreed levels of activity, levels of capacity for our patients to be treated in line with a number of our GIRFT recommendations, so cataract patients can safely now go to an independent provider to have their treatment. We also continue to work with some of the big hospitals such as the Nuffield, so some of our urology patients can go there and be offered their services, their space to have their treatment, and we continue to review that capacity. And where possible, we are also offering capacity and support to our colleagues in other trusts, because we need to be able to see that where we have some capacity that may support patients that are waiting in York or in Leeds. And if the patients are willing to travel and able to travel, then we should be offering our support and help to them as much as they are offering it to us too. So fundamentally, however, we can't forget our teams and our staff. So we're taking a lot of time to work with them through these pathways, because we need to understand that sometimes they needed to stop and take a breath. So what we have introduced is Feedback Fridays, Walkabout Wednesdays, where as multidisciplinary teams, we walk around the hospital, we talk to the teams, we understand how they feel, we help them access support if needed. We also do things like unblock any problems that they might be facing, whether that be a printer that's broken or, they need new chairs, because all of that really helps them get through their day. And by helping them get through their day, we help keep our patients coming through our services. So it's really important we take that time. Thank you.
Thanks very much, Claire and Beth. I hope you found that interesting to see how things have changed and continue to evolve. Our final presentation is from our Chairman and Managing Director of Harrogate Integrated Facilities, which is our wholly owned subsidiary. So Mark Chamberlain and Angie Gillett, the floor is yours.
Great. Thanks, Angela. Good evening, everyone. My name is Mark Chamberlain. I'm pleased to say I'm chair of Harrogate Integrated Facilities, otherwise known as HIF, which you will have heard quite a few times tonight, which is good. And I'm joined by Angie Gillett, who is the managing director. Yep. And we've got more than one slide, so I need the clicker. Okay, so who are we? Who is HIF? And I will refer to it as HIF. We were established in 2017, and we started actively doing business in 2018. We are 100% owned by the Trust, and the great majority of the work we do is for the Trust actually as well. We employ 350 staff, and our budget is £18 million a year. So we're not massive, but we're not small either. People quite often still ask me, well, what does HIF do? And so I thought it was important to have a bit of a list here that tells you some of the things that we actually do. We have estate management, so that's all the buildings, making sure that they are operational, fit for purpose, maintained, etc. Facilities management, that's all the porters you see around the site, all the catering, so Harriet's restaurant, all domestic staff who are cleaning our wards and making sure that they are up to the standard they need to be to ensure we have effective infection control. Sterile Services, which is all about taking the instruments that we use in, for example, our operating theatres, making sure that they are sterile and ready when they're needed. The medical equipment library, which is provides the service of medical equipment that isn't necessarily used all the time, but is there, is available, and they do get used a lot. And it's things like automated syringe drivers and other pieces of equipment like that. And then finally, the general office. And the general office is at the front of the hospital, and they deal with all sorts of things, from car parking issues to, sadly, bereavement, to a wide range of issues. It's quite a varied team. So to tell you a little bit more about what we've been doing, I'm going to hand over to Angie.
Thank you very much, Mark. So how did we respond to the pandemic? So some of this is a very personal view that I'll give you this evening, but I've worked in the Trust in various roles for a number of years, and I have to say it was one of the most challenging experiences that I ever gone through. However, HIF and HDFT team responded brilliantly to all of that. It was a time when we came together very much as one. We found solutions to things that we didn't think were probably possible. And people would go that extra mile, whatever was required. So whether that was people in HIF doing jobs that they hadn't done before in different localities or across the organisation, some of our SSD colleagues worked in different areas of the Trust at that time, or whether it was people from within the Trust working as a domestic or in catering for a while, or I know some people went actually and trained how to work in the general office if they were needed. So they could be redeployed as and when was required if staff were not available. But what I'd like to just talk about a little bit is some of the key areas that we focused around, and I have focused a little bit on more of the building side of things in some instances. We had to literally reorganise our site. It needed to be divided into zones, I think, as colleagues have already talked about. And there were green zones and there were red zones. And I think at one point we had a blue zone, but that went. And then we created a yellow zone, and it was all very zone-like. And then we changed that and thought, well, we needed to actually deliver a lot of projects now, a lot of building projects, a lot of changes. And I asked a colleague to actually work out how many we'd actually done in that 12-month period, we did 23. And if you'd have said that to me before the pandemic, could we do that? I'd have said absolutely not, but it just shows the measure of the individuals that were involved, and we did. And I'm very proud to be part of that team that delivered that. So we had a need for extra oxygen. We had a couple of weeks to sort that out, and we came up with some very innovative ideas of how we could do that, which other trusts actually followed suit as well, of how they could apply a similar concept that we did. We refurbished our ITU department, which looks fantastic now, and I know the staff are really happy with the outcome of that. And as we've indicated, we rezoned the hospital as well. And linked to that, a lot of the team within HIF actually supported work to get the in readiness Nightingale, which thankfully we didn't need to open in earnest, but we were ready. We had staff ready to be deployed there if necessary. So continuing in relation to our response, medical equipment, we had to increase our supplies in relation to infusion pumps, mattresses, ventilators, and the logistics of that were quite complicated. Our catering staff were sort of thrown down the gauntlet a little bit of staff can't get to the restaurant. So how do we actually look to provide services to staff that are confined on the wards? So we came up with new initiatives of meal ordering, which again, our volunteers and other members of the team went to the ward to take orders for lunch for staff. Obviously, our domestic services team were in the thick of it with our infection prevention and control team. We looked at enhancing our deep cleaning team, having people on sort of standby 24/7. And then we also looked at the logistics of developing services for our community teams with our volunteers around PPE and also equipment. And then towards Christmas, as people were feeling a little bit, we looked with our charity colleagues at how we could actually support delivering a bit of sparkle, as one of my colleagues would describe it in the charity, to some of our service users who lived alone, who probably wouldn't see anybody. And so we got a Christmas hamper through to them, and the feedback we got on that was immense. And then added to that, we then had the thought of, so what else could we do? And we worked with our 0 to 19 service, with children's services around actually delivering toys and presents to children across our patch. And again, that was linked with our portering team, who we christened our elves for Christmas, which was very nice. So recovery. Well, because we did it once, we thought we'd reorganise the site again and see what else we could do, just to change it that little bit more. Put some things back where we had before, and then again, maybe change it around a little bit again. But we also know that we've got quite a large capital programme to deliver as well across HIF. So we're starting to focus on that side as well, which will be really exciting. A lot of my colleagues have talked about staff health and wellbeing. It's something that everybody is aware of. And in HIF, we are looking at how we can make some of the areas across the site actually a place where people can just go and chill out a little bit for a short time. So if you come into the hospital, you will start to see changes in our courtyard areas. We've got some nice pod-like buildings that have been created in 1 or 2. We have a vegetable garden which people can utilise, and some of our catering staff, chefs, are actually going to look at the herbs and things that are in there. So that's something that is very much on our agenda, and how we will continue to support our staff through all of that. Our sterile service team are actively getting involved with the recovery side of the work we do, and so making sure all our instruments for theatres are readily available again. And we're also looking at what equipment needs we have going forwards as well. Making sure that we've got the right number of mattresses, that they're in the right place, and moving forward on some of the new bits of equipment that we need. And we're also taking a view on what have we learned, what's gone really well and what hasn't. And I think, picking up a point that Suzanne made earlier, I think some of the processes that we have, we've become slicker at, that we've got different ideas, and looking at how we can actually bring those as part of our business as usual, rather than just to respond to a pandemic situation. So looking ahead, I'll hand you back to Mark.
Thanks, Angie. Right, this is part of a journey. So we do, as we says on this slide, need to look ahead. Our absolute priority in HIF has been over the last 12 months or so, and will remain, our people. Because if we don't have an engaged and motivated workforce doing the sorts of jobs we've just talked about, then it's not going to work. It's really, really important to us. So we will continue to support our staff and make sure that they've got the tools and the training and the engagement to do the job they need to do for us. But as Angie said, this is also about learning. So there are things that we've tried a few things and we will learn from them. Some of them have worked really well. Some of them will be, things that we will revise. But we're making a real point of listening and understanding what works well, and actually making that part of what we do going forward. We've got a programme looking at the site where we work, so predominantly Harrogate Hospital, but also all those other sites across the patch that HDFT covers, of which there are loads. And so we have a programme of improvements that we would like to make, and we'll be actually moving through that programme over the coming year. But we also take a lead on the environmental side of the particularly the building infrastructure, but the broader environmental agenda. And we were very, very pleased to receive a grant of £14 million from the government to improve our carbon footprint in the predominantly again in the hospital site. If you walk around, you will see people on the roofs. They're repairing some of the roofs. We're having solar panels that are going in. There's a ground source heat pump going to be installed soon, and we're delighted to be driving that agenda forward. And I suppose just to finish on one final point, and it kind of recognises the fact that we when we kind of try to do things with good people, achieving good things. One of our porters, Faz, he was one of, I think, 7 people in the NHS who had his hands cast to make a special celebratory badge, and we're delighted with that. It's great to have one of our people recognised in that way as part of a broader recognition of the NHS and everything it means. So thank you.
Thank you very much, Mark and Angie. Thank you very much. We now come to the part of the agenda which is the more formal business, where we present you with the annual report and the accounts. And to do that, we've got our Chief Executive, Steve Russell, and Deputy Director of Finance, Jordan Mackay.
Thank you very much, Angela. Hello, everybody. My name's Steve. Mark, have you still got the clicker?
Oh, I've got it.
Oh, phew. Moment of panic. So, as I said, hello, my name's Steve. I'm Chief Exec here at HDFT. And what I'm going to try and do is just draw out some of the highlights of the year that are set out in the annual report. And then Jordan's going to talk about our use of resources and the financial environment that we've been working in, which has been very, very different in common with many things to previous years. So I've been in the NHS for about 24 years. In fact, last week was my 24th anniversary of starting the training scheme. And you'll hear many of us say exactly the same thing, which is the past year has been a year like absolutely no other, both personally and professionally. We didn't collaborate on our presentations this evening, but you'll see that what I'm going to refer to is very similar to what colleagues have done, but they have done it already much better than I will do it justice. And hopefully the way in which people have described the year in a way it's been for people across the service will have resonated with you. We have 4,800 colleagues across HDFT and HIF who have absolutely, in a way that words simply cannot describe, gone the extra mile many, many times over. In times of incredible uncertainty. And it's really hard to try and describe in words, as I'm going to do over the next few slides, what it's been like for them. And as Angela said, we are incredibly grateful for the efforts of each and every single colleague at HDFT and HIF. And so I'm going to use somebody else's words to try and convey to you how we feel about our colleagues. And these are the words of Leah Knight Wrights, who's a poet, and we asked her to write some words that would convey the sentiment that we have for our colleagues. We recorded this in a video for the exec team, and they were much better at it than I'm going to do it. And it's fittingly on the front of our annual summary. It's a poem called You're Incredible to Me. If you're here to collect the laundry, making sure our wards are clean, scrubbing surfaces multiple times, you're incredible to me. If you're here for end-of-life support, sharing last moments as patients sleep, bringing comfort loved ones can't, you're incredible to me. If you're here to clean the windows, offering the only outdoors they'll see, clearing the way to make their day, you're incredible to me. If you're here on our community team for adults, safeguarding, or 0 to 19, where would we be without you? You're incredible to me. If you're a doctor, a nurse, or an AHP, a surgeon, or a theatre trainee, each time you step through those doors, you're incredible to me. If you're here to answer the phone, guide us all to where we should be, making sure we all have what we need, you're incredible to me. Together we are the greatest, a family, Team HDFT. Each and every one of you, you're incredible to me. And those words, of course, are the words of our board, the words of our exec team, and the words of so many colleagues across HDFT and HIF. So as I said, this has been an incredible year. It's been an extraordinary year and an extraordinary challenging year for an incredible team of colleagues. And we know much more now than we did at the time. When we go back, I was very struck by Suzanne's description earlier of just what we didn't know as we entered the pandemic and then the uncertainty that colleagues had to deal with. Colleagues have really appreciated the support from their peers, their friends, their families, but of course, members of the public who, as Angela said, showed their support in so many, many different ways. And that meant an incredible amount to colleagues who were in very difficult circumstances often, and many people made very personal sacrifices to continue to work in the NHS over that period of time. We had a number of colleagues who moved out of their family homes and stayed in hotels so that they could continue to work. Colleagues have all referenced the impact that this has had on our colleagues, and our HR team worked really quickly and continue to do so to put in place all sorts of wellbeing support for our colleagues across the pandemic. They did that really quietly in the background, but in a way that has been incredibly valuable to many, many people across the service. So as we stand here today, this is about our period for March, 1st of April 2020 to March 2021. Our first patient with coronavirus was admitted on the 15th of March. It's a day that many of us will never forget. And that was despite all of the preparations that had gone before. It still came home on that day that this was real, and it was real for people across our organisation. In the year, we've treated just over 760 patients. As we stand here today with COVID, as we stand here today, we're close to 1,000. At the time, as we said, much was unknown. And so we had to, as colleagues have said, make decisions really quickly. We were very, very lucky to be able to be guided by a group of colleagues, a group of clinicians from all sorts of different disciplines and professions who helped us make decisions in the face of lots of unknowns. Around 100 patients through that period with COVID were treated in critical care, and 600 patients recovered and went home. But of course, like many communities, we're very alert to the loss of life and the tragic loss of life that we saw here at HDFT. And tragically, 160 people lost their lives. We also lost 2 colleagues through the pandemic, which was an incredibly difficult period for all of those who worked with them. As people have said, this year saw teams change pretty much all of the time, many times over, People had to adapt to working from home and in different circumstances at a minute's notice. And in doing so, trying to make sure that we continue to offer care to patients who needed us. Beth and Claire referenced this earlier, but around a quarter of our outpatient contacts are now done virtually. And in the year, there was 80,000 virtual contacts between clinical colleagues and patients. Our community teams, who have often been unseen through the pandemic, our district nurses, our podiatrists, our community physios, continue to visit people at home to try and keep them well and independent, particularly those who were vulnerable and shielding. And they conducted 120,000 visits across the year. I think it's probably the vast majority of people have now been subject to a swab of some description as part of the pandemic. And our labs processed just short of 40,000 COVID swabs during that period of time. And our teams, our PPE team, personal protective equipment team, distributed just over 29 million items of personal protective equipment. That's easy to say, and what's not easy to say is there were moments through the pandemic where we would go home in the evening knowing how many items of PPE we had left and how long we thought we would have until we ran out of PPE, particularly in the early stage of the pandemic. We never did, but it was one of the most stressful periods through the pandemic because we wanted to make sure our colleagues and patients were safe. As Suzanne has said, we cover not just the hospital and community services, but our 0 to 19 services across North Yorkshire and the North East. And school nurses, health visitors and early year practitioners are another group of colleagues whose contribution through the pandemic hasn't been as visible as I think we would like it to be. They supported over 100,000 families with 200,000 contacts, many face-to-face, but many virtual. And as Susanna said, our teams have had to deal with many different things or of a different order. So lockdown suppressed the virus transmission, but it also created an environment that Susanna's powerfully described, which exposed children and families to much greater risks of domestic violence and neglect. It increased stress on families, on new families, and there's been a disruption to routines and behaviours. And many of the support systems that are normally available to families weren't there through the pandemic. And so when health visitors and school nurses visited, they were often one of the very few people from a professional perspective that those families were seeing. And so they've had to support a more intense and a very different range of issues. The families who needed more targeted support, as we describe it, nearly doubled, as did the support needs of the most vulnerable children. And Suzanne talks about safeguarding, which is the most extreme end of the work that we do. It's one of the most important bits of work that we do. And although we've talked a lot about critical care doubling in capacity, so too did safeguarding. The safeguarding burden more than doubled in our school nursing and health visiting teams. And safeguarding in many ways, in my sort of simple brain, is the critical care service for 0 to 19-year-olds. So it's been an absolutely incredibly challenging year for those teams who have responded fantastically. It's easy to think that the year was dominated just by COVID, and it played a huge part, of course it did. But we continued to provide many other services and to treat people with other illnesses who needed us. And we sought to try and restart some of our planned services in the summertime. Maternity had a really busy year. There was 1,700 children born. There was a huge investment that we made in a service that's called Arches. I always forget what it stands for. The best way to describe it is a group of very committed community colleagues who look after people in their own homes. We expanded it through the year, and they looked after and supported the discharge of over 4,500 people. And at the peak, we're looking after 38 people in their own homes who otherwise would have been in beds. That's better for them, it's safer for them, it's where people generally want to be. As Beth said, we carried on treating urgent patients who needed either cancer surgery or urgent operations, and over 1,600 cancer treatments took place. And a service that you might have heard a little bit about last year if you dialed into our online annual members meeting, which is Active Against Cancer, a service that was set up last year, went from strength to strength this year. They have obviously had to adapt to an online environment at the same time as everybody else. But they won a national and regional parliamentary award for the work that they did. We were slightly disappointed that they came second nationally, but they haven't got over it, but we've sort of got over it because the people that they lost to, in inverted commas, was the team that developed the COVID vaccine. So it sort of felt fair, but I wouldn't tell them that. So as Angela said, it was an incredibly poignant moment when we started vaccinating colleagues in around January time. We started with our own staff, and then we expanded to vaccinate wider health and social care colleagues. In 25 days, 65 people supported the vaccine hub, and the first vaccines were given to over 7,000 people. By the end of the programme, just short of 90% of HDFT and HIF colleagues were double vaccinated. And whilst they're not here, it's really important to give a very personal and collective thank you to 3 colleagues in particular who absolutely worked tirelessly to make sure that centre worked. They are Kate, our chief pharmacist, Leslie Danby, who's one of our matrons, and Emma Oxterby, who's a service improvement facilitator. And they are absolute fantastic people, brilliant leaders, and without them, we would not be where we are this other side of the pandemic. I did also mention this at the beginning, but we want to try and continue to make HDFT the very best place to work. It's very important to us that our colleagues feel safe and supported and enjoy the work that they do. In general, that's the experience of many colleagues, but we want to try and get better all of the time, and we knew that it wasn't the case for everybody. And so, as Angela said, we did a major engagement through the autumn period, framed really simply around asking colleagues what makes a good day to be at work, and what makes a less good day. And the things that people have told us that make a good day are those behaviours and values that Angela mentioned at the beginning. I think it's important to say that clearly, as we went through the early part of the pandemic, we saw a drop in referrals from primary care, and we also slowed down the amount of work that we were doing. So referrals dropped, and we weren't able to treat as many patients as we historically had done. And although we've recovered services through the back end of the year, we're very, very conscious that our waiting times have risen, and the number of people who are waiting has also gone up. And so, as Beth said, a big part of this year is trying to continue to accelerate the pace around further recovering some of that capacity. You've heard the word team probably in every single person's description. Healthcare is a team sport. You all know that better than I do. We have across HDFT hundreds of different roles. We have over 60 nationalities, people from very different backgrounds with different experience that they all bring into Team HDFT and Team HIF. I wanted to draw out just a few things. So picture number 1 is a group of our domestic colleagues. Bear in mind that cleanliness was one of the most important things that we had through the early stages of the pandemic to fight the virus, and the importance of that continual attention to cleanliness across all of our services. And our domestic colleagues absolutely went the extra mile every single day. Picture number 2 is one of our volunteers. Who I don't think this one was one of the elves particularly, but we were very, very lucky to get support from so many volunteers in so many different ways across the year. Mark stole my thunder, but it is one of his colleagues, so it feels apt and appropriate for him to do so. The bottom right, number 3 anyway, is Jonathan, who's Deputy Chief Exec, who's taking a well-earned break this week, and Faz, one of our porters, who, as Mark said, had his hands cast as part of the National Memorial Pin. Whilst we talk a lot about our colleagues at HDFT and HIF, I think it's important, and I know the board would want to do this also, is to recognise the contribution of partners. So we've talked a lot about the work of our colleagues, but there is absolutely no way that the collective UK PLC, as it were, could have managed the last year without the absolutely incredible contribution of public health colleagues, social care colleagues, and many other departments within local government. And again, they perhaps receive less attention than we think is warranted. And so it's important that we pay a very personal thank you to all of them. Just to illustrate one example of that, across the pandemic, when there were restrictions on schools, head teachers across all of our patch opened schools so that the children of key workers could continue to go to school, which allowed people in turn to come to work and to care for people who needed their support. And we often hear the term frontline. It's a word that's used a lot, but to build on my point about healthcare being a team sport just a little further, I think from our perspective, we think that every single one of our nearly 5,000 colleagues is part of the single front line. Again, Angie's covered some of this, but the amount that had to be done to allow everybody to respond in the way they did was quite indescribable. So the top right, Angie talked about oxygen and coming up with an ingenious way to make sure that oxygen supply was delivered evenly and in the volumes that was needed to all of our site. Though that picture of papers, calculations, and I think a calculator, was one of our estates colleagues' kitchen tables over a weekend, working out how to deliver that. The picture in the middle at the bottom is a thank you to the support that we've had from the community. We've had loads of support, but one that I think will remain with us forever, partly because of the colour clashes in the early stages, is from the Harrogate Scrubbers, who came together as a community to help make scrubs for colleagues who had been used to wearing their own clothes at work and suddenly had to wear a uniform or scrubs. And finally, as Angie's said, bottom right, many teams not only contributed to the response at HDFT, but supported the work at the Nightingale. Our medical equipment team, our IT colleagues, and our catering colleagues, to name but a few. So I guess as we look ahead, the year that we're in, people often describe this as sort of beyond COVID, and I think the reality is, as you'll all know, and as Angela said, COVID remains with us, and as we head into winter, we're uncertain about exactly how the various winter demands, flu and COVID, may come together. So it's an area of continued focus for teams across the trust. We've got loads that we want to continue to do, but we've got 5 major priorities. The first is to recover our planned care services to try and make sure that we can continue to reduce waiting times, but to do so in a way that doesn't exacerbate health inequalities. We've all seen the impact of COVID on health inequalities, and part of our priority is to make sure that we try to do so in a way that doesn't cause further exacerbation. Second, as Suzanne said, is to support our colleagues in 0 to 19 services, hopefully to get back to some of the really important preventative work that they do. Thirdly, is to focus on the health and well-being of our colleagues, but also on the people that we're here to serve, and to try and think about people in a holistic way, which leads very nicely into the 4th priority, which is around our focus on consistently high standards in what we would class as the fundamentals of care, or a better way to describe it, as Emma would, is personalised holistic care. And that's a programme of work that came out of a difficult, serious incident that occurred during the year in a complaint. And finally, to continue the work that we've started on culture, and continuing to try and make HDFT and HIF fantastic places to work. And that, of course, sits alongside all sorts of other stuff in terms of pathway improvements to emergency care, and our green investment that HIF colleagues are bringing forward. So I guess I'd like to I'd like to finish where I started, which is with an enormous thank you to each and every one of the colleagues at HDFT and HIF, and to all of the partners who have helped us and who we know continue to help us through. This picture is a drawing that was done by the twins of one of our colleagues, and is a card that we posted out to everybody last year to say thank you. So I hope that's made some sense. As I said, it will not have done justice in the way that my colleagues before did, but I hope that gives you a bit of a flavour of the year, and I will hand over to Jordan to present the annual accounts.
Evening, everyone. My name's Jordan Mackay. I'm the Deputy Director of Finance here at Harrogate Trust. So I'm just going to take you through our accounts for 2021. So just the first thing to say on this, starting with as a finance person would do, with a table. We've got what we spent and what our income was last financial year in terms of 2021. And our surplus overall was essentially a break-even position, £41,000 surplus. We spent just under £300 million and received pretty much income to cover that. So we achieved our targets for the year. That was working in a context of all the things that people have just described, all of the changes that people have done through the year, all the things that people have had to react to and the challenges. We still broke even in terms of our position, which is positive. Our cash balance on there is probably worth drawing out. We had £34 million of cash at the end of last financial year. If I just sort of give some context to that, the previous financial year, we ended the year with just over £3.5 million in our bank. And we were, at the time of that, we're struggling with kind of essentially making payments. And one of the things over the last year has focused us a bit more on cash management, not least for our own organisation, but how we support other organisations outside of the NHS and locally. So just in terms of some things on here, and that's quite small, so I'll talk through them. Some things to note. On the slide there, it describes that we received £16 million of COVID funding to fund things like additional staffing across the trust, the vaccine programme, a bit around PPE and testing equipment and consumables, and also a lot of the health and wellbeing things that people have talked about. 16 million probably undersells it. It's the official figure that we had, but we also had money that the PPE element there was provided, the people who were providing it, the actual PPE, the 29 million items of PPE that Steve mentioned. That was another 4.2 million on top of that. That's what we spent on PPE last year. We also had a reduction in income in terms of what we were getting externally that we had to manage. That reduction of income, be it for private patients, be it for car parking, be it for all other things the organisation does, research and training. That reduction was about £4.6 million. So we had some income that came through for that. And overall, the amount of support, if you like, that we had for COVID, including those things, came to about £26 million. So a sizable amount of money that we received last year that we wouldn't have received the previous year, and it was as a result of COVID. Bit of context on 26 million, that's what we spend on outpatients in a year beforehand, the whole of outpatients, all of our outpatients appointments. The cash balance bit I've mentioned is significantly better than it was, which is positive. In 2019-20, we paid our bills quite slowly. We paid 12% of our bills within 30 days. In 2021, we made the decision of ensuring that we were paying them a lot more promptly to support the local economy, to support other organisations. So we took that 12%, and at the end of last financial year, and it's something I'm really proud of, is we reported a figure of 78% in terms of our payments, which is a massive increase. And we've continued to increase that this financial year as well. That's a little bit in terms of clearing some old debts. That's a little bit in terms of ensuring that we get some payments in advance. That contributes to the position. And there's also some process stuff that goes on amongst that, which has been positive. And then the last bit around this, and people have touched on the various things that we've done to the trust site, is capital funding. And I'll just brief sort of slide in terms of some of the major things that we've done in terms of capital that you can see there. We've, in terms of supporting some of the home working that Suzanne mentioned earlier, there was a lot of IT infrastructure that was put in place. A lot of things like not just the sort of the networking, but also the nuts and bolts of the equipment. There's the work on the intensive care unit that people have referred to. Oxygen infrastructure, as Steve mentioned, in terms of the picture of that. ED X-ray, cardiac cath lab, and the coronary care unit. Lots of work that's gone on in terms of reacting to COVID, but also reacting to COVID may sound quick. That some of the work that's been done there has been done to such a high standard, such a positive standard in terms of what's been done. And also people have turned to us to learn from us, as Angie sort of referred to as some of the oxygen work. In terms of our overall accounts, this is very much in terms of to give assurance. Our external auditors have given us an unqualified opinion, which is a good thing. It's a clean bill of health and reflects a true and fair view of the financial position of the trust. The other thing that they do in terms of the external auditors is provide assurance that we have are providing value for money for taxpayers. So that's also come through in there. And they were satisfied that the annual report that is consistent with the detail in the financial accounts. So look into 21-22 in terms of where we are at the moment. In terms of the going around the circle of thing, revised financial regime. There's a lot of news and topical for the weekend in terms of settlements for the NHS for the second half of the year. I think it's probably fair to say that there's still a level of uncertainty, and we're managing that uncertainty. We're still developing a plan for the trust. We're working with our partners to make sure that we mitigate some of that uncertainty. We've got a really big capital programme, £32 million capital programme for this financial year. So last year was 16 million. That was big for us to start with. And some of it's the Salix work that Mark's mentioned. Some of it is around doing refurbishment of our ward areas, CT scanner and other things, but lots of benefit again to the organisation. One of the things that we'll need to come to terms with as we're recovering from COVID or re-establishing our services with COVID still around is the pathway back to the long-term plan. So the long-term plan was pulled together before the pandemic started, of looking at the financial settlements and the direction of travel for the NHS moving forward. The idea is to get back into that place now that we know that COVID is going to, I've got a friend there, sorry. COVID is going to stay. So there is a bit of work to do around some of that. A little bit is really positive to hear some of the things that Claire describes in terms of the transformation that we're doing to continue some of those things that we started pre-COVID. We've got some of the costs continuing that I mentioned. So PPE hasn't stopped being distributed. That level of what I talked about earlier continues. And there's the support then for the elective care recovery. And Beth and Claire have already talked a bit about that. Finally, the bit on here is productivity and efficiency. And one of the things that it's fair to say from a regulation point of view that was eased is the focus was on how do we recover, how do we respond to the pandemic, not necessarily the sort of the level of efficiency, CIP, cost improvement side of things that we were expected in the years that were leading up to now. There absolutely will be a focus on how do we go back to being more productive, more efficient with some of the things that we put in place. I've used the language back to, I'm not entirely sure that's right. I think some of it is how do we build on some of the things that we've changed? How do we put some better things in place? So some final thoughts from me, and this might be ill-advised, but as I was listening to everyone else, I've changed what my final thoughts were. So there's a little bit on some of this that is I was sort of struck when I was listening to both Suzanne and Angie talk, was around decision making, and obviously part of what we do in terms of quick decision making is we also have to make sure that we're using taxpayer money well, that we're being responsible with funds that we have. And I think one of the things the pandemic has shown is that we can do that and do it quickly rather than procrastinate about decisions. And there's some learning that we need to take forward with some of that. There's a bit when we're recovering, restoring services and everything else that we look to in terms of value. So again, coming back to what Claire and Beth were describing, a lot of the pathway changes represent better value for money in terms of taxpayers, as well as better value for the patients who are going through those pathways, as well as a better experience for staff and patients who are involved. So there's building on things like that to be positive. I think also the sort of thing around value is things like our payment practice, remembering that that's really important to our suppliers, remembering that's really important to our localities and the businesses that work there. It resets that bar that we need to have. I suppose finally the bit that a lot of people have mentioned, Steve mentioned, is the complication and challenge that we've had over the last year, 18 months, and how everyone's risen to the challenge. Now, it will be challenging, I suppose, in terms of the financial framework that we might have moving forward, some of the efficiencies we might have, the idea of recovering at the same time of managing our financial position at the same time as still dealing with COVID. But we've risen to that challenge before, so I'm still optimistic that when we move into, well, not we're into 21-22 now, but as we're moving forward, that we can take that on positively. And that's all from me.
Thank you, Jordan. Thanks very much, Jordan. And now Claire Illingworth is going to give us an update on the Council of Governors.
Doesn't quite work with just your hands, does it? Hello, everybody. So I am Claire Illingworth, and I'm going to talk to you about the work of the governors. So the Council of Governors is chaired by the chairman of the trust. There are 18 elected governors, 13 of which are public and 5 are staff, and then we have 6 stakeholder governors. I'd like to take this opportunity here to say a huge thank you and a very fond farewell to the following governors. Caroline Heaney, stakeholder governor for the patient experience, left us earlier, I think it was the end of last year, and Dr. Christopher Mitchell also left us. And more recently, Neil Lorber has left us, Councillor Samantha Mearns, Dr. Pam Bagley, Robert Cowans and Kath Cleland. So we've just undertaken our delayed governor elections. They were due to be carried out last year, but we did postpone them to this year. And the results from the summer elections are Donald Coverdale, who is here this evening, as our public governor for Ripon and West District. We have Mary Kelly, Knaresborough and East District Public Governor, and we have Professor Karen Stansfield, who is also here from Bradford University, and we have Ian Barlow, who is on his 2nd term as Public Governor, and also Andrew Jackson, who is also here as our clinical other governor. So the roles and responsibilities for the governors, we have many different duties. We have some that are statutory, and then we have other duties as well. So our statutory duties are ensuring that we contribute to and carry out the non-executive director appraisals and the chairman appraisals. We attend council meetings where we seek assurance and ask questions. We attend board meetings, along with lots of other activities as well. Generally, what we do is we are seeking assurance in all of the things that we do. So we observe subcommittees of the board. We attend briefings. We have other meetings with the non-exec directors. We have meetings with each other. We have lots of opportunities to talk to each other and to hold the non-executives to account. So part of our role as well is we have a membership and engagement committee as well. So this seeks to ensure that we're effective engaging with the membership and the community, which includes ways to improve that engagement as well. And we have been very fortunate and grateful as a council that we've had a very active board, and that despite the extra workload the pandemic has created, we have ensured they've ensured the council has been kept up to date by holding and committing to extra briefings and been responding to our endless questions. So it's been very responsive this year. The Council of Governors approved the reappointment of the chairman and the non-executive directors this year. So that's Angela, that's Richard, Laura and Maureen. And we have been busy. So we have just undertaken the non-exec appraisals and the chairman appraisals. We have full attendance at all the board subcommittees, which are the Resource Committee, Audit and Quality, and the newer People and Culture Committee as well. We have a named governor that sits for 6 months on the committee, and then another one can attend as well. We have been cited on the more recently, the 21 and 22 quality priorities, and also the recruitment presentations for the Executive Director of Nursing, Midwifery and AHPs, and also the Director of Strategy. We have attended NHS providers training virtually this time, and we've been working on our membership engagement. So it's been a year like no other for everyone, including governors, who we must remember are volunteers. They give up their time for the council. Yet in a year where it would have been easier just to relent, they have shown dedication, they have engaged, and they have demonstrated their commitment and in representing the interests of the members, the public, the staff, and the patients, including embracing the technology and at times battling with all of the notorious glitches that we have all had to accept as normal now. And we have just had our first council meeting in person where nobody had to put £1 in the pot for saying you're on mute. So that was worth celebrating tonight, I think. So that's me. Thank you.
Thank you very much. Thanks very much to all of our presenters this evening. We've now come to our final session, which is we invited members to submit questions in advance of the meeting. And so we've had some questions and we've identified colleagues who will provide the responses. And our Company Secretary, Kate Southgate, is going to read out the questions and then she knows who's going to provide the answers. So are you going to come up here, Kate, or are you staying there?
I'll stay. Do you want me to stay here? I'll stay here. Okay, so our first question that we've got this evening comes from Charles Gibson. So Charles has sent in a question regarding having batteries sent to patients for their hearing aids, as well as being able to self-collect. So I'm going to hand that question over to Russell Nightingale, our Chief Operating Officer.
Hi everyone, I'm Russell, the Chief Operating Officer. So in response to Charles' question, the audiology service at Harrogate is networked with York and Scarborough, and in end of 2020 a decision was made, obviously due to COVID, to start posting the batteries for hearing aids out to the batteries used to be able to be collected from the audiology department at HDFT. We used to send them by post. Main hospital reception desk at the 3 hospitals, from local GP surgeries and some libraries as well. Obviously during COVID, lots of those places closed, reduced footfall, so we couldn't provide the batteries anymore. So we decided to follow the decision that York and Scarborough made a year prior, which was to post out batteries to people that needed them with hearing aids. And instead of sending them every 3 months or them being collected every 3 months, we're sending a year's worth of batteries when they need them, when they're replaced. This is a short-term fix. In the next 24 months, you'll be glad to know that the NHS is replacing batteries in hearing aids with rechargeable hearing aids, which is obviously better for the environment and saves a bit of money. So that's happening in sort of the next 24 months, but we decided to stick with this. The feedback's generally been quite positive, that people don't have to leave, the batteries come to their house, they're getting a year's worth of batteries, they're getting a bit of trust. And it's a 24-month fix. So hopefully that answers Charles' question, who isn't here.
Thank you. Charles has actually let us know that he can't come this evening. So we will put the questions and the answers to the questions on the Trust website. So you can access them separately as well. Next question, Kate.
Okay, so our next question comes from John Topping. And John asks, what physical and mental health care is available to veterans and how many did we deal with this year? So I'm going to pass that question over to Jackie Andrews, who's our Executive Medical Director.
Thank you, Kate, and good evening, everybody. Jacqueline Andrews, I'm the Medical Director here at the Trust. So I think we're all well aware in the last few weeks with all the very challenging images coming out of Afghanistan of just what an amazing job our armed forces do. And the Trust is really, really proud to support our armed forces community. For those that don't know, the Armed Forces Covenant in 2012 enshrined in law that armed forces who required healthcare as part of their service commitment had priority access, and that is absolutely enshrined in our patient access policy here at HDFT. So all GPs or anyone referring into our service is able to identify if that person is a veteran, and then we will signpost them to the appropriate service. We also there has been recent development of mental health additional support for veterans, which we signposted all our clinicians to how to access that for veterans. We are doing more than we have done in the past, in that we're working with an organisation called the Veterans Covenant Healthcare Alliance, who are supporting us to become an accredited NHS trust to support veterans. So there are a number of schemes that we have to show that we are delivering. We started that work about 6 months ago. Myself and Angela Wilkinson, our Director of HR, is working with James, who's the regional lead for that organisation, and we're hoping to be accredited as an organisation very soon. We're really keen for anyone who's interested or perhaps has experience of armed forces to be part of that task and finish group that we're putting together. So if any governors or members would like to be part of that work stream, then please do get in touch with the membership team. Thank you.
Thanks very much, Jackie. Thanks for that. Hope you found that interesting. I wasn't aware of much as that, so thank you very much. Kate, next question.
Yeah, so the next question comes from Lee Channeler Chadwick, and Lee's asking how many GPs are currently working within the Trust's catchment area and how many of these are working part-time? So I'm going to pass that question to Jackie.
Thank you. And I'm not sure if Lee's here, but we don't employ the GPs, so we don't have access to that information, but we certainly can signpost Lee to our CCG, our local CCG, the Clinical Commissioning Group. Again, I'm sure the membership team would be very happy to provide their contact details, who would be able to provide that.
Thanks, Jackie. Next one, Kate.
Yeah, so our next question comes from Fiona Wilson. So Fiona asks, a couple of years ago, Deloitte were commissioned to investigate alleged bullying within HDFT and its subsidiary HIF. In July of this year, Stray Ferret reported an anonymous email criticising the HDFT chief executive and was circulated to HDFT NEDs, including the chairman, the CQC and the local media. I understand that the trust chairman investigated the alleged allegations. My question is, why did the chairman undertake this investigation and not a third party like Deloitte? How could she be assured that members of staff would speak to her when the email had alleged a fear of reprisal? So, Angela, if I pass that one across to you.
No, Laura Robson.
Oh, Laura.
Laura's answering.
So Laura Robson is our senior independent non-exec director.
Thank you. As Kate says, I'm Laura Robson, Senior Independent Director. Just to clarify this particular question, the actual question's incorrect. The Trust Chairman did not undertake the investigation into this email. It was undertaken by the non-executive directors, and the Trust Chairman wasn't part of that investigation. So the question's not correct in that assumption. If you want a bit of context to this, an anonymous email was received by some of the Trust executive, by some of the non-executives, well, all of the non-executives, and some of the governors, sorry. What we would say about this is it's actually a failure of our freedom to speak up arrangements, because the person made an anonymous email and we could not engage at all with that particular individual or group of individuals we don't know. And therefore we had to make some assumptions, and we had to do the investigation based upon our assumptions. We did try to contact the person in an anonymous way. They didn't need to come forward. They could have engaged with us anonymously, but they chose not to. So we undertook the investigation. We did this in pairs, and we did it giving full confidence about anonymity, that they wouldn't be identified, and they spoke up. And we did have some people who were prepared to speak up to us, so that we know that there was confidence that people could talk to us. So the investigation is now complete. It's been discussed at the board, it's been discussed with the governors, and we have now concluded it, made our recommendations, and they will be followed through in due course.
Thanks, Laura. And I think the final question, Kate.
Yep, I've got one final question, again from Fiona, and the question is, I understand that the Rainbow Pedestrian Crossing and Rainbow Tunnel on the HDH site were paid for out of charitable funds and were commissioned to send a message that the hospital and the trust as a whole is an open, inclusive and non-judgmental place for LGBTQ+ patients, visitors and staff. My question is whether the Trust has measured, for example, quantitatively or qualitatively, if the crossings and tunnel have made this desired aim, and therefore the public who contributed to the charitable funds can be assured that it was an appropriate use of the funds. If no assessment has been made, then please can this be done and reported back to Trust members as soon as possible. So I'm going to hand this question across to Angela Wilkinson, who is our Director of HR and OD.
Hi everybody, Angela Wilkinson, Director of Workforce and OD. Thank you for the question, Fiona. Yes, the Rainbow Tunnel, hopefully you saw that on Steve's slides. It was photograph 1. We have the fabulous picture of our domestic team standing in the tunnel. And those of you who visited the hospital site will have seen the tunnel that links 2 of our buildings has been adorned with the rainbow colours. Now that tunnel, the rainbow colouring on that tunnel emerged originally during the pandemic. As you'll all be aware, the rainbow became very quickly a sign of support for NHS staff. But as you all know as well, it is very widely known worldwide as being the symbol for the LGBT community, and it's an expression of support for that as well. So in order to do that and show that support, the rainbow crossings were commissioned in addition to that. And from my perspective, these are really, really important visual signs, as the questioner pointed out, where we can show our support for that community and for all of our colleagues within HDFT. Not just LGBT colleagues, but also everybody in HDFT, regardless of race or gender or any of the other protected characteristics. But this is a really important part of that visual programme that we have to show support. Now, measuring something which is staff experience is very difficult. It's really not possible to measure that experience and link it to one thing. So in terms of measuring whether the crossings have been a success in terms of improving the experience of LGBT staff, I think everybody in the room would appreciate it's not ideal, it's not really possible to do that. So what my job is responsible for is making sure that we have a whole set of actions and interventions across HDFT, which combined try to make us the best place to work for people and make sure that everybody has the best experience. And visual signs are a really important part of that. But in addition to that, we've embedded a number of other actions across the Trust to make sure that we're not just having signs, we're actually putting our money where our mouth is and expecting our people practices to make sure that our colleagues are having the opportunity to express how they feel, and our managers and all of us are responsible for making sure that people who work for us have an equal experience at work. We've changed our appraisal process, we've introduced a health and wellbeing discussion, we've changed some of our recruitment processes. All of those have a really important focus on equality, and we are expecting all of our new members of staff and all of our existing members of staff to be given the opportunity to have those discussions and to be recruited to those values. Listening and learning and understanding how everybody feels is one of the ways we measure this. And we do that through our staff surveys, which is an annual survey. We also have a number of new surveys that we've introduced, which run at least quarterly. They're quick surveys, colleagues access them on their app, and that gives us really good information for people to be able to take actions and understand how people are feeling. So we'll be reporting on those through our committee soon. What I'd like to say in summary, prior to the tunnel and the crossings, and prior to the pandemic actually, when we analysed some of our staff survey results, what we found when we looked at those results across all of the different protected characteristics, we found that a number of our LGBT colleagues felt unable to declare that. And it's their prerogative, it's a personal thing. But if we don't know, we can't make sure that those employees are having the right experiences, and only by creating a safe employment environment where people feel they can come to work, be themselves, and not suffer any discrimination is really important. So we're working really hard to make sure that we create that space through all of the initiatives that you've seen today.
Thanks, Angela. the question also asked, made a comment about the funding source. Did you just want to clarify that?
Apologies, sorry. I think the total cost was less than £5,000 for the crossings, as I understand it. I'm not sure if Angie or any other colleagues want to comment on.
I think to clarify that the funding source wasn't the charity.
Oh, apologies, I wasn't aware of that.
We have a special budget for equality, diversity and inclusion, and so the funding source wasn't from the Harrogate Hospital and Community Charity. Thank you. Well, we've run over our time. I'd just like to thank you very, very much indeed for coming. I'm sorry for keeping you a little bit later than we'd advertised, and that means we haven't really got time for any more questions. But I hope you've enjoyed it. I hope you've enjoyed being in company. We've really enjoyed being able to give you a cup of tea and a biscuit. Not very lavish hospitality, but we've really, really enjoyed seeing you here this evening. We hope that you've felt informed about what's been going on in the Trust over the last 18 months or so. And we really, really would look forward to seeing you again at the annual members meeting next year. We will, in the meantime, be keeping you informed through our newsletters. We've not been great at newsletters. We've had a few other things on our minds recently, but we are going to ensure that there is a regular bi-monthly newsletter in future. So thank you very, very much indeed for coming. And it's really been very, very good to see you. Thank you. Thank you.